physical therapy.
Hello and good morning. Welcome to Introduction to Health Promotion and Wellness. Well, what's in this course? What's in this course is the focus on health promotion, injury prevention, fitness and wellness all across the ages, you know. And they would be there would be screening, some of course some assessment and intervention for the kids and the old people, even adults, There's also for the special populations. You still gotta promote your health and wellness to them. And then um, you wanna participate in organizations and efforts that support the role of PT in furthering the health and wellness of the public. Maybe go with social media, promoting the public. There are also laws and regulations about PT. We know that, and we want to discuss the practice standards as they affect PT practice, or the American Physical Therapy Association practice. And you want to give culturally competent PT to different groups. You want to be on top of it, right? Like, um, you got to adapt on different locations, ages, and socioeconomic populations, and on how you would treat them, right? You can just go in and do what you want, like, and then you wanna be like promote health and quality of life, to different ages, genders, cultures, and different peoples with different lifestyles as a PT. And you wanna go deep, analyze some data about prevention and wellness. So that's how you're gonna sell it. Analyze those epidemiological data, analyze those data, interpret those data, and then see if it's a cost-effective measure, and see if it's gonna, be logical to give to individuals, groups, and people. If you're gonna implement something, it should be like cheap, it should be available and effective for different populations. For different populations, you gotta be specific. If it's for kids, for adults, for the elderly, it it has to be um, effective specifically to those age group population. Um, like I said about different populations, you gotta you gotta think about their wellness intervention and involve them in the decision making. And you should like show leadership, like you be in charge about organizations and volunteer service. Yeah, and what's health? Health is like the freedom from disease, injury, or illness, and it's like having a component of wellness, and you got a great quality of life and well-being. Health status is like what? The state of the conditions that compromise good health. No, it comprises, not compromises. You cannot compromise good health. Health status is when you have good health. All right. Wellness is like multidimensional. It's kind of like eight dimensional. If you go to some website, spiritually, financially, emotionally, socioeconomically, psychologically, all the lead that you could think of. It just means your positive health on you have a positive health as an individual, and you have a great sense well of being and good quality of life too. Physical fitness, you can be at your peak performance in your daily and leisure activities. That's your means you're fit. And some, components of physical fitness is like your heart, your lungs, your muscles, power, endurance, some flexibility, your body composition, Is it muscle, more muscle than fat, Also, physical fitness also includes relaxation. So you can't be fit without relaxation. You need that to be whole. What does APTA say? APTA say, um, APTA, they put their foot in health promotion and wellness, and they say it's essential part of PT practice. So better put that in your arsenal. Health promotion and wellness. It's like outside of the usual clinical setting. Health promotion and wellness. You're gonna have some knowledge and skills acquisition. Knowledge and skills acquisition, KSA, for PTs that are core competencies. So you got your professional skills, and you have your after school education. Um, they say that by 2020, that is this year, PTs should be the primary point practitioners that participate as essential members of the multidisciplinary healthcare team addressing health promotion and wellness. By 2020, we are the frontliners of uh, we're gonna be the frontliners of health and wellness, and we're gonna manage the patients and the clients. That means clients like outside the clinic, and that's cool because that's like extra income if it's outside the clinic. PTs and consumers must learn more about the role of PT in promoting health and wellness, collaboration with and referral to from other healthcare providers. So we got people from nursing, social workers, MDs, they refer to PT for the decision making, man. Because PT gotta decide. And we refer back to them, to the nurses, social workers, MDs, psychologists. And then they also consult us, those people. And then we could retain those patients. Yeah, we could retain them even after they're done with the program. We still give them plan of care, some accountability, because that's how a PT operates. You don't just leave them in the curb. And you can also always direct and supervise them, even if the the inpatient program or outpatient program is finished already. But it has some limitations. There's some liabilities, of course, because they're taking your advice. You should you should also explain to them the expectations and awareness that there's some risk in everything, right? And there are also some reimbursement limitations. And some states might or might not allow this stuff to happen, but mostly there's general acceptance to health promotion and wellness in not all states. So, how you overcome it? So, you just be an advocate of health and wellness. You have to accept that you're responsible for everyone's health and wellness. So if you don't know about the expectations and you got some questions, you can always go to community outreach, study some patient client education materials, and you can do some in service. You want to read some of the state and legal limitations and practice acts so you can improve your knowledge about your scope and your responsibility. And reimbursement limitations. Don't be shy. Collect some private pay. And you can also get some free screenings. Give them out free screenings. So do you be more accessible, right? You studied so hard for this. Patient client management is an ongoing dynamic process because the patient clients has evolving needs. It's not static. It's like the rivers is just flowing. Like there's always something. When you go when someone goes for PD services, you gotta go for their history, systems review, their heart, their lungs, lymphatic system, ENT, neuro, MSE. Gotta ask them about all that, and then you gotta give them some tests and measures. Check their walking, even their skin integumentary, their joint integrity, mostly their strength, muscle strength, check their neurological status, sensation, if they have any pain. And you should plug in the potential benefit from physical therapy. Then go in, develop a plan of care. And if there's any referrals, you could refer them. If part of their wellness is lacking that you cannot address, you could refer them to other professionals. And then usually it's done in a first session to establish plan of care. But you could always progress, modify what's needed in the plan of care. You know what I'm saying? And then there's the evaluation. After all that, you gotta evaluate. You're still gonna continue to examine and identify the current functional limitation and potential for injury or disease. Um, I just want to educate people about diagnosis and prognosis. What's diagnosis? Diagnosis, PT use that label that identify the impact of a condition on function, the level of the system, and at the level of the whole person. So diagnosis, PTs use labels that identify the impact of a condition on function at the level of the system and at the level of the whole person. PTs implement a systematic approach to establish a diagnosis. And what's prognosis? Prognosis is the determination of the predicted optimal level of improvement in function and the amount of time needed to reach that level. So PTs must consider what is the highest level that individual is capable of achieving and what is the highest level that is likely to be habitual for that individual. Prognosis is like when you give them a amount of time that they're gonna be alright. Okay. Yeah. Okay. Alright. So intervention. So you're gonna interact with the individuals, be involved in their plan of care. You be involved, step your foot on that pedal. You, as a PT, you will select, you will prescribe, and you will implement these interventions based on your data, your evaluation, diagnosis, prognosis, and goals for your clients. So there are lots of there are actually 9 interventions in PT. So these are the updated interventions in PT. The patient client instruction, number one. Number two, the biophysical agents. Number three, assistive technology. Number four, airway clearance techniques. Number five, functional training. Number six, manual therapy. Number seven, integumentary repair and protection. Number eight, motor function training. And last but not the least is your therapeutic exercise. So those are your um, interventions. Your mnemonics would be PBA, AFM, IMT. PBA, AFM, IMT. Your mnemonics. So, patient client outcomes. So, what are your resulta or results when you implement a plan of care? Um, one of the outcomes is that in the domains is the we consider outcomes in the following domains. You consider outcome in the pathology, impairments, in the activity limitation, in the restriction, in participation, and then also the societal resources, and also your client satisfaction. So your outcomes can be statistical, it could be shared with the patient, healthcare members, and third party payers. Your outcomes can be shared with those people, and it is effective in helping to see if you could progress them or progress the intervention, if you could progress them safely. your outcomes will be able to tell if you could determine the safe progression. So, in the APTA, American PT Association, they advocate pretty well the prevention, wellness, fitness, health promotion, and management of disease and disability. They want to manage that. If you got a disease, you want to manage that. If you got disability, you want to manage that. And pretty much that's it. That's your intro to health promotion and wellness. See you next time.